Welcome everyone, live with Dr. Carolyn Dean here on AchieveRadio.com. It's Monday, January 14th, and we are rocking it out with Dr. Dean again this evening. My name's Ginny Sanders, also known as Ginny Almighty, and I'll be your host along with Dr. Dean this evening for 2 hours of life-changing information on how to consider your body as the most perfect creation ever, how to employ these fundamental, structural, functional nutrients to your benefit, and how to expect glorious health recovery and longevity. That's what we're after. It's not just recovering our health, but living and living well. And you know what they say, that the heart of the matter is the matter of the heart. And I cannot think of a person who has ascribed more time to helping people's hearts than Dr. Carolyn Dean. 50 years, ladies and gentlemen, 50 years in the medical field with natural medicine and with allopathic medicine. And she has carved out a place for herself in history as one of the leaders, most insightful people on how to use nutritional medicine to the advantage of the body from child to elderly. And you're going to be listening and talking with her tonight about her favorite topic in the whole wide world, which is magnesium and mineral supplementation, along with all kinds of other things, how to help that body, that mind, that spirit. And tonight, specifically the heart. And in 2019, we're setting some new challenges for ourselves to get people's hearts healthy and established and stable, and not only to do it for ourselves, but to do it for our family and to evolve other people and evoke them to the same expectation. So without further ado, I'm going to turn it over to Dr. Dean. Let me just say that in addition to her incredible experience as a doctor and a naturopath and an herbalist and an acupuncturist and an author and everything else, scuba diver and rock climber and extraordinary human being and international traveler and soothsayer and all kinds of other things. She, in spite of all the things she knows, she does not give out medical advice on her shows. Oh, no, she would never do that. But she would tell you what she would do if it were her faced with the same thing. And that's what we are hoping to hear from her tonight, what she would do. So welcome back, everybody. Here she is, Dr. Carolyn Dean.
Oh, thank you, Ginny. Once again, you totally overwhelmed me with your introduction. It's just so tiring hearing about this person who does so much, and it just can't be me, because if it was me, I would be totally exhausted. I wouldn't be able to even function. So it can't be me. It's maybe one of my clones. That's what's going on. I'm convinced.
Nice try.
I've been cloned. I know I say I've been cloned by Ginny and her customer service people, because they really do speak for me. They speak my words, and I'm just so grateful for that, to be able to spread the information far and wide. And Ginny's blog this week is so perfect. I mean, it's exactly what I had in mind. We hardly ever communicate about what she's going to blog about. And this blog, which you can find on, actually, is it there yet, Ginny? I don't know if it popped up on drcarolyndeanlive.com, because...
Oh, no, it's there. Oh, you couldn't find it?
No, I'll have to go to another browser, and I don't need it. But what I'm going to tell people is you can look in your emails, of course, and find it, because Ginny sent it out this morning before the show, or this afternoon. And it says, Magnesium and Cardiovascular Health, an urgent call to action. And what she's mimicking there, and she ends the blog, and I'll get to the blog in a minute, she's talking about our friend James Nicolantonio. I've been practicing. James Nicolantonio. And he's a PhD cardiovascular research. He's got 200 publications under his name and a number of books, and he is a going concern. He's I don't know how old he is, but he's going to be around for a long time. And his paper that you can have access to. You can print this up. You can download this paper. It's open access, British Medical Journal, highly reputable medical journal. Title, and you can Google this and find it, Subclinical Magnesium Deficiency, a principal driver of cardiovascular disease and a public health crisis. A public health crisis. You know, we've been kind of saying those words over the years and trying to wake people up, but people will say, well, where's your proof? And really our proof is in the pudding. When people take the pudding, they take the minerals and they do what we suggest, then they can replace the deficient minerals in their body that are causing them to have symptoms that make doctors feel they have heart disease. But in fact, they may be having magnesium deficiency and other mineral deficiencies. So download that. I want you to, I'm going to say repay me. Now, nobody owes me anything, but we get a lot of accolades of people saying, you saved my life. You know, I don't hear that, and I just do what I do, and if people take my advice, then they're saving their own lives. But if in any way you want to pass on what I've been saying for decades and certainly the past 10 years, you get this article, British Medical Journal, Subclinical Magnesium Deficiency, a principal driver of cardiovascular disease and a public health crisis. You can download it as a real pretty PDF. It's 16 pages. There are 3 authors. They have a list of references. I'm just going to the end of the paper. They have 233 references. You print that up and you take it to every doctor you see. You print that up and you give it to all your friends and your family and say, did you know that there's a public health crisis about the minerals I've been telling you about? Did you know there's a public health crisis of magnesium deficiency? This is 2019. We've got to do something. We've got to wake people up. We've got to give them the solution. And if you've been sitting back and waiting for the evidence, well, prove it. How can you prove this? And as I said, the proof is in the pudding, but some people won't take the pudding. And you can't force the pudding down their throat. So if they're going to be amenable to science and research, etc., this is what you show them. This is a public health crisis. Okay? Get the picture? Ginny, come in here and tell me how awesome that statement was.
Very good. Yes, I think it should be something that should be handed out every time a person goes to the doctor, no matter what kind of doctor it is. It doesn't matter if it's a proctologist or if it's a brain surgeon or whatever, because nobody gets to live if they don't have a working heart. And everything's related in the body. And so it is something that's incredibly important. We have to keep pointing this out. And I think the statement that they bring to the forefront is to say that with such an obvious, easily accessible cure in magnesium, why would we delay any longer? It's not like we're calling for a public health crisis and then we're saying there's no solution, or give us millions of dollars of research so we can figure out how to solve it. It's already solved. It's not even a question. You know what I mean?
Yeah. Oh, gosh, yes. And I've been saying that for ages. Stop with the billion-dollar studies and just get people on Remag and see the difference. It's pretty obvious right now in our society that the drug companies are running your health. And you can let them do that. Go right ahead, but you don't have to. You have options, and we have solutions. So the blog, Ginny has some stats, just to, again, improve what we're talking about. Everybody knows this. Cardiovascular disease is the underlying cause of death, accounting for nearly 836,546 deaths in the U.S. That's over 750,000. 1 in 3 deaths in the U.S. is for heart disease. 2,300 Americans die of cardiovascular disease each day, an average of 1 death every 38 seconds. Claims more lives each year than all forms of cancer and lower respiratory disease combined. 92.1 million American adults are living with some sort of heart disease or the after effects of stroke. Direct and indirect costs of heart disease and stroke, more than $329 billion. That's where we could save the economy, folks, is by saving your hearts. Do you not realize that? Nearly half of all black adults have some form of heart disease, 47.7% of females and 46% of males. See, they have all these statistics. They are being counters to the grave. So we have all these stats, but we're not making use of them, and we're certainly not turning them around. So then we've got the heart disease leading cause of death. 43.8% of deaths are heart disease, and on and on. And Ginny writes, by the time you finish reading this email, another 4 Americans will have had a heart attack, and another 4 will have had a stroke or heart failure. What can be done to prevent this human avalanche of death from cascading into your life or the life of your loved ones? 3 things you need to know about magnesium and heart disease. This is from the Magnesium Miracle. Magnesium prevents muscle spasms of the blood vessels in the heart, which can lead to heart attack. 2, magnesium prevents muscle spasms of the peripheral blood vessels, which can lead to high blood pressure. 3, magnesium prevents calcium buildup in the cholesterol plaque in arteries, which leads to clogged arteries, atherosclerosis, and stroke. And since 2001, she says, I've been making the public aware that magnesium deficiency is a contributing factor to heart disease, and magnesium saturation contributes greatly to heart health and proper cardiovascular function. And then she works up to Dr. Dean Nicolantonio's article saying, recently Dr. Dean has been joined by cardiovascular doctors and researchers around the world, citing the importance of magnesium supplementation as a strategy for improving the structure and function of the entire cardiovascular system. The summary of one finding states, subclinical magnesium deficiency increases the risk of numerous types of heart disease, costs nations around the world an incalculable amount of healthcare costs and suffering, and should be considered a public health crisis. That an easy, cost-effective strategy exists to prevent and treat subclinical magnesium deficiency should provide an urgent call to action. And so this is at Dean Nicolantonio's abstract, the last paragraph of it, and he starts the abstract. And seriously, I'm telling you, go online, get this article. Ginny can find the URL for you and put it on the chat if you like. But print this up in the PDF form. It looks pretty cool, and start passing it around. And the start of the abstract, he even acknowledges what we've been saying all along. Because serum magnesium does not reflect intracellular magnesium, the latter making up more than 99% of total body magnesium, most cases of magnesium deficiency are undiagnosed. Now, what cellular magnesium is ionic magnesium. And that's what REMAG is, stabilized ions of magnesium. So if you measure someone who's taking Remag with a ionized magnesium test and compare it to serum magnesium, you'll see the difference. But the ionized magnesium test is just in research facilities, and it's not been put on the public market as it should be. So what has happened is that this serum magnesium is the test for magnesium. It does not reflect what you have in your cells, and therefore most cases of magnesium deficiency are undiagnosed. James goes on to say, furthermore, because of chronic diseases and medications, decreases in food crop magnesium content, and the availability of refined and processed foods, the vast majority of people in modern societies are at risk for magnesium deficiency. So there you have it. We've talked about it, the chronic diseases, people on all the meds that drain magnesium. There's not enough magnesium in your food. When you refine it and process it, it's even less. So the vast majority of people in modern societies are at risk for magnesium deficiency, yet you'll read over and over again in content-driven articles that people really don't suffer from magnesium deficiency. I'm doing a blog right now, and even these people, the magnesium deficiency deniers, they'll say, well, yeah, people who are chronically, oh, yeah, okay, people who are on meds, oh, you know, the growing people, these people may need more magnesium. I came up with 175% of the population needs magnesium, looking at the percent population who have chronic disease, who are on medications, the youth, pregnancy. So seriously, everybody needs magnesium. And then he finishes up with the statement we already said, which I will repeat. Subclinical magnesium deficiency increases the risk of numerous types of cardiovascular disease, costs nations around the world an incalculable amount of healthcare costs and suffering, and should be considered a public health crisis. That an easy, cost-effective strategy exists to prevent and treat subclinical magnesium deficiency should provide an urgent call to action. And, of course, he's just talking about heart disease. He's not talking about the 65 diseases that I've listed in the Magnesium Miracle 2017 that are being misdiagnosed. So, yeah, print that up. When you come back to next week's radio show, I want people on the chat line to tell me how many articles they've given out. This is a call to action. This is payback time. Now, what I'm going to do, that's my rant for the show, but we've gotten dozens of questions to Ginny's blog, from Ginny's blog. So I'm going to dive into those before we go to the phones so that I don't have to write everybody back. I can speak to the answers. Okay, Paul asks, he said, I have already had a massive heart attack, left ascending artery, I think that's LAD, 100% blocked. Obviously, I survived by the skin of my teeth. Will Remag help to keep future heart attacks away? And if possible, how much Remag a day dosage? By the way, I love all your products. You were sent by God. Huh? Sweet. So we have a number of questions like this. And what happens with your arteries? They do get calcified. Now, doctors used to say, well, they're getting filled with cholesterol plaque. Well, the plaque is there along with calcium. The cholesterol is there with the calcium. What happens is the arteries will get irritated and injured, and cholesterol will come along and try to Band-Aid up the irritation or the rent, R-E-N-T, in the artery. And then calcium will come along to stabilize it. And when that gets to be too much, then you get your blocked coronary arteries, carotid neck arteries, and kidney arteries. Every artery can be blocked. It's not just the heart. So it's this calcification that's building and building and building And what you do is you cut back on your calcium intake. You only look at taking 600 milligrams of calcium a day, not the 1,200, 1,500 milligrams that medicine has been telling you to take. They have created this problem. So you go to your diet list of calcium in foods, and you see whether or not you're getting 600. If you're getting 600 in your diet, you stay there. And then if you do have the problem, you double up on your magnesium. I mean, I'm talking about 1,200 milligrams of Remag, which is what I had to take for my heart palpitations to help solubilize the calcium in the soft tissue where it's not required. And of course you're going to change your diet, and the diet I recommend, the yeast diet would be the first one for people who have symptomatology, because it's usually too much wheat or gluten, sugar, and dairy. Now, I'm eating dairy with my keto diet, but I'm not taking any recalcia. So that's what you're going to do, Paul, is double up on your Remag and look at your other minerals too. You're not going to treat Remag as a drug, and it sounds like you are on all the products. So you're going to be taking 2 teaspoons of Remite, or this is what I would do. That's how I have to say it. 2 teaspoons of Remite for the 4 teaspoons of Remag, and slowly build up to that. You get your Realign in there to help your nervous system, your adrenal glands, to help digestion, to help the detoxification with the methylated Bs that are in Realign. The amino acids in Realign are precursors to glutathione, which is your heavy metal detoxifier, because some of this blockage is going to be heavy metals. And I know doctors talk about using chelation on blocked arteries, but sometimes that massive chelation will strip out all kinds of minerals. What we're doing here is just a very gentle detoxification and chelation. Next question from Barbara. Recently made a visit to the ER, 71 years of age, chest pain. They decided it was not my heart. It was a musculoskeletal condition that came about because of the way in which I laid in bed, caused my rib cage to rub against my cartilage, causing the pain. Chest x-ray then, however, showed an enlarged heart, and my blood pressure began to be extremely high. November 2018. My question is, how do I get my heart to resize itself back to normal size? Been working to stay stress-free. That's good. Have been able to drastically lower my blood pressure. And she asked, it does not sound like she's a customer yet. Do you believe that Remag will help my heart go back to its normal size? I'm sure it will be good for me. I'm concerned about getting my heart size back to normal. Yes, my belief is that the body has a blueprint for the correct size heart for Barbara, and that if you give it the building blocks, it will resize. And all what I said earlier to Paul, this is what you're going to do, Barbara. Look at the 3 to 4 teaspoons of Remag, half as much Remite, do your Realign. The restructure is also very important in people who are healing from heart disease. What we have in our knowledge base about decalcification of arteries is people who tell us their results. And the one I have talked about is carotid arteries that were blocked. I think there was a 40% decrease in one woman after 3 months of being on our products, and that's all the products. I'm talking about Remag, Remite, Realign, Restructure, and the RNA drops. So The other evidence we have is the ejection fraction that will show when the heart is enlarged, the ejection fraction is weaker, and people's ejection fraction it goes back to normal. I mean, I'm amazed at what happens there. So we know this is happening. We're not saying we're curing heart disease. We're just saying we're supporting the structure and function of the body, and the body wants to function normally, and if you give it the building blocks, it will. And Glenda is asking how much magnesium should a 69-year-old woman get daily. It does depend, Glenda. I had to take 4 teaspoons for a year and a half of the Remag. That's 1,200 milligrams. I actually, though, was cutting back when I took Remide, and then when I got saturated, I'm now taking 1 to 1.5 teaspoons a day. That's around the RDA, 300 to 450 milligrams a day. So I'm in maintenance. So you start out by saturating, and then you lower it as your symptoms go away and as you feel better, and you will get some of the laxative effect, even with Remag, when you are saturated. But that will take about a year to get saturation. If you have the laxative effect before that time, we look at just the bowel. Do you have irritable bowel? Do you need more fiber? Do you have yeast overgrowth? So I started with Paul, gave him the overview of what to take, and that goes for everybody with any sort of magnesium deficiency or any sort of heart disease, which is our topic for today. Susan says, I have had high blood pressure and high cholesterol for decades. I'm presently on 25 milligrams of hydrochlorothiazide. That's a diuretic that will deplete the body of magnesium. Since October, I've been taking Remag. How long should one wait to get results concerning the above issue? Well, depends on how much you're taking. You've heard me now talk to the 3 previous people telling them how much to take. So it's a matter of taking the Remag, balancing your other minerals with Remite, and of course your sea salted water. All our water is so depleted of minerals because it's all filtered to get rid of the drugs in the water and all the chemicals in the water. So we have to replace it with sea salt, which is not table salt sodium chloride. Sea salt has 72 minerals. And in terms of had it for decades, high blood pressure and high cholesterol, then you've been depleted for years. You've been on medications that have depleted you. You're still on hydrochlorothiazide. Do not stop your medications. You can take all our products while you're on medications, and you'll see when your blood pressure improves and your cholesterol improves. And the diet would be important. Go to drcarolyndeanlive.com and look at my book on yeast, Reset the Yeast Connection, because there's possibility that the yeast overgrowth could be creating some of your problems. The next question is about calcium dosing. Now, I've already mentioned above about calcium, so let's see if there's anything else. Dr. Dean says in her book, 1-to-1 balance of calcium to magnesium, best for most people. She goes on to say she favors calcium RDA from the UK and WHO 600 milligrams. They're taking 3 teaspoons per day for 2 years and getting 600 milligrams of calcium from foods and recalcium. Should we increase our calcium to 900? No. Stick with 600 and use the extra magnesium for stress or symptoms. What am I doing? I'm eating dairy and my 1.5 teaspoons, so I don't need recalcia. the baseline of calcium is always going to be 600 milligrams. When I say the 1-to-1 balance, that's sort of a generalization. But as you're saying, Lou, you're both 81 years old, and that is where you probably want to take a little more magnesium to keep working on past calcification, because aging symptoms equal calcification. That's what I know. They're doing 1.5 teaspoons of Remite. That's good. 2 Realign, good. 16 drops of RNA Reset a day, and the serving of Restructure. That's awesome. And he's doing muscle testing. He's been muscle testing himself since 1980, he says, which is awesome. You can look that up. It's the O-ring testing. It would be good if people were able to test themselves in the beginning when you use that type of self-testing. It's like, oh, how do I trust this? What do I know? But really, after a while, and it could be a year, when you go to test something, it's like your mind gives you the answer, and then your O-ring just confirms it. You know the answer to these questions about what to take and what to do. And he says, other than muscle testing, how could we dose our calcium? No, I'm just saying stick with the 600 milligrams. And then Lou's been doing his reading, because he says, Dr. Dean has said that joint pain is likely calcium deposits. Also, I remember her saying that she gets some mild pain in her knees. She needs more calcium. We have some joint pain. Yeah, see, this is tricky because joint pain can be calcification. If it's like arthritic pain that you've had all along, or you and your wife have had in the past, then that's your calcification. If it's just an ache in your knees that comes out of the blue, that's what I'm talking about when I've had a lack of calcium. And I first started getting it when I was playing around with giving myself intravenous chelation treatments to see what all the hoopla was about. And it wasn't long. It was like the second or third chelation I did on myself where my knees started to ache. And I said, oh my gosh, it's pulling out all my minerals. This can't be good. So hopefully that gives you some answers. I know it's difficult to look at even calcium tests to get an answer. Lou continues that he's wondering about the EXA test, EXA-TEST. I talk about that in my books. It tests for 6 minerals at the cellular level, but it is expensive, and a doctor has to do the collecting, so I don't really push it that much. And even then, I mean, when you do a test that just stands alone without doing, a range of tests to compare, I don't know if that is accurate enough to allow a person to know how much to take. That's why I'm really convinced about the 600 milligrams, and then see how you feel. If you have questions, and keep asking us, and as you fine tune. Where are we? We're good. Stephen says, can taking magnesium help to reduce the calcium buildup in an artificial bio heart valve? Yeah, I don't have any statistics on that, but I cannot see why the magnesium saturating in your blood and your cells, why it wouldn't be working on artificial bio heart valves. That may mean a pig valve. But I don't have the science. I just have the common sense. Okay, Leland says, after discovering the benefits of Remite last year in May, by consistently taking them, 4 teaspoons of Remag, 1 teaspoon Remite daily, mixed in half my body weight in ounces of filtered water with sea salt added, along with 3 3,500 milligrams of potassium. I've seen my blood pressure reduced to an average of around 125, 130 over 65/70 from 150/55 to 70/75. I have also in the last month seen my severe leg cramps disappear. I also have purchased and utilized your Pico Silver, RNA Reset, and Remag Lotion. Additionally, I have AFib and have seen the events of that diminish in both quantity and the severity, and I'm going to continue to see if I can eliminate AFib events entirely like you have done in the past. Now, I personally did not have AFib. I just had heart palpitations, ventricular premature contractions, and runs of I could have had runs of AFib, but I wasn't diagnosed with AFib, just to clear that up. But a lot of people, as I write about in the Atrial Fibrillation, Remineralize Your Heart book, a lot of people, just as Leland is describing, everything improves, and it does take time. Okay. This is an important part here. Leland's saying, recently I discovered information on the benefits of having a coronary artery calcium scan to determine my risk of heart attack. The results show, now he gives me a score, and I couldn't find a comparison numbers in time, but he says as well as mild calcification of the aortic valve and the descending thoracic aorta. Also, the main pulmonary artery is dilated, and he says it puts him in the 91st percentile for 72-year-old adult males. Now, to me, it's TMI in a sense, too much information. It makes you feel like, oh, my gosh, this is, when you see it in black and white, it's like, oh, my gosh, and what's going on? And then he's doing all the good things, the blood pressure's improving, everything's improving, but he says, I'm unsure. I mean, this testing makes him unsure as to what lifestyle changes need to be made that can potentially reduce the amount of calcium in my heart's plumbing. Well, the 4 teaspoons of Remag, I would say make sure you're only getting the 600 milligrams of calcium in your diet. Don't take Recalcia, which I don't think he is. And I guess this brings me, around to the brief discussion, as I've done in my blogs, about coronary artery calcium scans, because there are no drugs that will dissolve calcium. They do this test and give people too much information and scare them. And then what do they suggest? My doctor first suggested statins. That's all they know. And the statins to, reduce cholesterol, which now is being proven more and more not to cause heart disease. So he said, I firmly declined. Then he suggested red rice yeast, which he said I found out later is also a statin. I've been searching for something that can possibly help lower the score by reducing the amount of calcium in my blood vessels. I do not take calcium supplements and have started to follow a keto diet along with intermittent fasting and exercise 3 to 5 times per week. My goal is to reduce my weight over the next 6 months from 205 to 190. So that's perfect. I mean, going on a yeast-free diet, which is what a keto diet is, but even on the keto diet, that's why I said even with your diet, make sure it's only 600 milligrams of calcium. And exercise, the sea salted water, Lee's doing everything correctly. And heaven forbid, who knows what the coronary calcium scan showed last year before he started doing the Remag, etc. And I imagine next year it will be improved. And the point is not to dive into a whole bunch of supplements and get distracted from these basics that we talk about. when you look on the internet for what can reduce calcium, they talk about different foods and whatnot, and mainly it's eliminating refined foods and high calcium foods or calcium fortified foods. Okay, so that's Lee. Now, Svetlana is saying, I need your help. Now, I appreciate people asking me for help, but basically I give information. I can't be a person's doctor, but I'm definitely here to support getting a person's health back. But look what she says. I'm 40 years old. She's that's young in our customer base. She's a labor and delivery nurse working full time, 3 night shifts a week. They work 12-hour shifts. I have 2 kids, 11-year-old girl and 3-year-old boy. I need to be healthy and active and happy for them. Recently, I've been having chest pains, dizziness, nausea, headaches, bad headache, etc., etc. Finally, I don't know if she measured her own blood pressure, 183 over 107. Her eyes were red. She had a pounding headache, all the symptoms of high blood pressure. She got scared, ended up in the ER. They stabilized her, gave her blood pressure meds. I started taking the meds, but even that is not helping. Resting blood pressure 150 over 100, sometimes 140 over 100. I started juicing, following Dr. Schultz's bowel detox program. I do not smoke, do not drink. I'm 145 pounds. I think I was in denial all that time, but now it's time to pay attention. This high blood pressure is not a joke. I need your help. What should I do to get my blood pressure normal? Now, again, I'm not anybody's doctor. I just know that there's probably some weight loss that can be done here. Juicing, make sure it's organic. Dr. Schultz does have some good programs, but it's not about bowel detoxification. It's about probably a yeast detox. If you start doing especially things like a liver detox, you know how they say to do all these things, don't do a liver detox out of the chute because you can release viruses. Hepatitis virus hangs out in the liver. Not to scare you, but you don't have to do heroic measures to get better. The blood pressure is probably not going down as much as it could because you're probably still working, you're probably still stressed, and being a nurse, you know that people are on these drugs for life and they don't seem to get better. That does not have to be the case. In any little bit of spare time you have, listen to our radio show, read some of my free ebooks at drcarolyndeanlive.com, and you'll know that the blood vessels are affected by the smooth muscles going into spasm from lack of magnesium. And they'll put pressure on the blood vessels and cause the high blood pressure. So we're looking at you losing some weight, taking the Remag, slowly building up to 3, maybe 4 teaspoons, taking Remite as well, because when you have even one child, your thyroid is drained, and the Remite has the 9 minerals that the thyroid requires. So go on the whole protocol. I doubt if you're eating proper breakfast, and I do intermittent fasting, but so I don't eat breakfast anymore. But if you on your work days, you should take the restructure to work, so you're not grabbing the donuts that patients leave for the nurses that just make them sick. So and Svetlana, call into customer service so that they can break it down for you and go step by step. And stay on your meds, don't get off them, and follow what other people have done to support the structure and function of their body. John asks, on testing for magnesium, is magnesium RBC the best test? Do doctors... Well, it's a better test than serum magnesium. It's not as good as ionized magnesium. Do doctors support getting this test? No, they don't. You have to order it on your own, usually at requestatest.com. It's only $49, or it used to be. How often should one test? I've never tested. I just care about my symptoms. I know that magnesium RBC test is not definitive, so I don't use it. What result is acceptable or ideal? Well, the ideal, we go for ideal, it would be at the 80th percentile of the test, because when you look at the results, the range, they call it, the range of results from a lab, it's the range of the sick population that walks into that lab every day. At least 80% of the population is deficient in magnesium, so they're going to be people who are rock bottom, and they'll look like they're in the normal range. You want to be up at the top. The range is 4.2, I think, to 6.8. I'd like to see people at 6, 6.5. But again, you want to look at clinical symptoms of magnesium deficiency and follow those. And then could I comment on bisglycinate chelate buffered form of magnesium? None of them are as effective as REMAG. REMAG is a stabilized ion of magnesium that gets directly into the cells. All these other forms are compounds. The body has to break them down. And although a compound in the bloodstream can separate and be a magnesium ion and a glycinate ion, they quickly, like immediately, bind up again. So you don't have stabilized ions unless you have REMAG. Kimberly says, if magnesium can prevent clogged arteries, can it also help dissolve existing clogs? Yes, we've talked about that, Kim. I really see that happening. Janine says almost 2 years of REMAG, and it's difficult to get past 2 teaspoons without loose stools, trying to get AFib, high blood pressure, and anxiety under control. Presently trying bentonite clay and carrot powder to help with increasing magnesium doses. Both of those help with binding up the stools. Psyllium seed powder as well. We tell people about that. There must be a reason why Janine is not using that. I would say to go on the yeast detox diet. That may be why the bowels are sensitive. So read my Yeast Connection book, Reset the Yeast Connection, and see if that makes sense to you, Janine. And you've probably talked to customer service about that already. Using REMAG lotion twice a day on arms, chest, legs. Is saturation possible with just 2 teaspoons of REMAG and lotion? 2 teaspoons, our recipe for making REMAG lotion is 200 milligrams per teaspoon. So 2 teaspoons of REMAG is just potentially 400 milligrams, so it's probably not enough. She's going on the trip and wondered about just using the lotion. If you're just using REMAG and expecting it to do everything, you may be on the other products, but it's very important to do the REMITE as well. What I found with my 4 teaspoons of REMAG is that when I started my REMITE, I did not need as much REMAG. So I was actually having other mineral deficiencies and kind of expecting my REMAG to take care of them. So be sure you're on the REMITE, the Realign, Restructure, and RNA drops as well. And, well, I'm going to do the whole hour. Vicki says, can magnesium help with high blood pressure when your kidneys are classified as failing? We see that all the time. Get in touch with customer service, and they'll give you my text from Magnesium Miracle about kidney disease. They talk more and more about failing kidneys now. It's calcification of the kidney arteries. Michelle says, I've had 2 minor strokes and The second stroke left me with constant and permanent pain my entire left side. I'm taking Remag for 3 weeks, and the changes in my brain are phenomenal. Now I was wondering what I can do for the pain, and will weight loss help? I need to lose 70 pounds. I'm also diabetic type 2. So, Michelle, you would be perfect for the ketogenic diet, the keto diet. I've written a book on that, so you can look that up at drcarolyndeanlive.com. For the rest of the pain, get the Remag lotion and start rubbing that in. You're very early into the treatment, so you have a ways to go, and each week you'll get better. So the keto diet, add the Remite, use the restructure in your weight loss diet, and keep in touch with customer service. One last blog question. Awesome. My husband has been diagnosed with congestive heart failure, been taking Remag for several months. I'd like to know how much. With congestive heart failure, I would be looking to take 3 and 4 teaspoons. His electrolytes have been within normal limits. I would like to add Remite, but I'm a little afraid of how that would affect his electrolytes. It would affect them positively. The Remite is low-potency ionized, stabilized ionized minerals, or stabilized mineral ions, I should say. And it's not an electrolyte per se. It's just minerals. That and the sea salted water are going to be very important, because the cells work with minerals and water. And if you don't have enough minerals and water in your cells, then that's where you start getting problems. Would Remite be good for him, and should I be wary of any problems with his blood thinners? No, you can take the minerals with any medication and stay on your meds until the doctor says you don't need them anymore. And I think this is Marsha I'm talking to. In the previous blogs that I've been answering, maybe I've given you enough information as well. Congestive heart failure, that's when the ejection fraction starts getting lower and lower, and as the heart structure and function improves, as it will with minerals, then the ejection fraction should improve. I have a blog called The Heart Doesn't Fail, Doctors Fail Patients, something like that. So you can look up that blog and see what I have to say about congestive heart failure. Ginny, over to you to take us to the top of the hour.
Okay, boy, you chewed that up, but it was all great information and valuable information for people who've written in and can get a straight answer from you. It was funny. Somebody told me a week or so ago that these doctors that have, they actually create paywalls around them where people have to pay to talk to them and get their advice, some of these, Dr. Access kind of people. And it just always amazes me how much great information you give and how much care and compassion you share on your show on Monday evenings. No charge. Don't even have to be a customer, nothing like that. It's just sincerely from your heart, knowing that you have a way to resolve problems, like you said, with the information. And I think the most important information people can have is that you may not have a disease. You may just have a magnesium deficiency. And as we pointed out earlier in the show, they're often misdiagnosed or unnoticed because of the way that the testing goes. But the bottom line is you can know from your symptoms, and the one thing that you can discover very easily is you invest a few bucks in a bottle of Remag. You take the Remag for 30, 45 days, and as you start to improve, you'll figure out pretty soon that all it was the magnesium deficiency. And that's probably the best news you could give anybody in a day of skyrocketing medical costs and situations where people don't. One of my friends is taking our Remag after he was diagnosed with all this AFib business, and they did all these kinds of things, ablations and everything, and they're actually having to take him off his cardio medicine now because his heart performance has improved so much just from being on Remag and Realign. That's all he takes. And they're calling it a miracle and saying that he's a marvel of modern medicine. And he keeps trying to tell him he's taking magnesium and Realign, and they just won't hear it. They're just shocked at his improvement. So it does happen. It does happen for people. It's extraordinary, and it's so wonderful what you do, Carolyn, on a weekly basis. I'm just, once again, so honored to be with you. We've got questions on the chat line. We've got some questions on the chat line, Bob.
Jenny, listen. I just want to add something.
Bob, I'm trying to tell our listeners.
We're at the top of the hour.
I know. It's one sentence. We do not say it comes from Carolyn's heart, it comes from our hypothalamus. I'm entering that meme to start it for 2019. It comes from the hypothalamus, not our heart.
Good grief.
Oh, Lord.
Ion knowledge.
Okay, great, Bob.
Nothing.
Ion knowledge.
Nothing.
All right, we'll be back at the top of the hour, everybody. Thank you. We'll be right back, and we'll get all your answers on the chat line.
Along with host Ginny Gumler after this brief station break. You can also get updates and resources online by visiting drcarolyndean.com.
Psychic radio, holistic radio, spiritual radio. This is achieveradio.com. Follow us on Twitter at twitter.com/achieveradio.
AchieveRadio.com. Here we go now. Go to the Carolyn. Here we go now. Here we go now. The wellness scene with Dr. D.
Welcome back, everybody. Hour 2, live with Dr. Carolyn Dean here on AchieveRadio.com. Thank you once again for tuning in. If you missed the first hour, it was action-packed. Here in the second hour, we'll have more of the same, including phone calls. Let me just remind everybody that 602-666-6027 is the number to call. That's 602-666-6027. And when you call in on the show, if you'd like to talk to Dr. Dean, you've got to hit *5 on your keypad. *5 is what raises your hand and let us know that you have a question or comment, and then we put you on the phone with Dr. Dean in order of the people who've raised their hands. And I do have raised hands here in the studio, so we're going to get to our callers. I also have lots of questions from the first hour, people interacting with you, Carolyn, about all the emails that you read. So hopefully we can kind of make this sync up a little bit. We'll do a couple at a time. The first one is, what about magnesium L-threonate?
Right. I didn't make an FAQ of this because I don't like to put down nutrients too much, but Ginny may have the commentary about it. This was a rat study where they compared their threonate to a, I don't know if it was a citrate. No, it was, anyway. and there was a 7% higher amount of magnesium in the cerebral spinal fluid at day 24 of intake. So based on that 7% higher, the whole world found out that magnesium threonate is the only magnesium that gets in the brain. And that really, really annoyed me, because if you look at the Adelaide book on magnesium and the central nervous system that you can get on the internet for free, they've got many studies on the nervous system showing that even the highly unabsorbed magnesium oxide at 4% shows benefits to the brain. So that whole study was very annoying. And then, oh gosh, it wasn't long. I mean, within the year, they tripled the price of threonate because they had gotten such good press on it. And when I take the Magtine threonate, I get the laxative effect, which means it's not being absorbed. I get it on just one little capsule, and in the bottle I had, 3 capsules of Magtine only gave me 144 milligrams of magnesium. I'd have to take 20 capsules a day to meet my magnesium requirements. So the whole thing is it was very annoying, as I said. That little blurb that we send out to people, or I would send out to people, I don't know if Ginny has it, but I'm just emailing it to you right now, Ginny. Okay? And people can email support@rnareset.com just to get my thoughts on magnesium L-threonate.
Wonderful. Mary types in, I've had 2 strokes, and I have been told I must take warfarin or I may have another major stroke or death. Any thoughts?
Take warfarin. I mean, I would. I'm sure I would. While I'm working out the other things, while I'm getting enough liquids in my body. So many people do not drink enough water. Their blood gets thick. They sit on airplanes more than they ever do. They don't use compression stockings, and they get blood clots, and the clot can go to the brain. So do the protocol that we talk about, the sea salted water, the remag, remite, realign, restructure, get your testing done, and as you improve, then you may not need the blood thinners.
Carolyn, so is that the reason why people are supposed to drink a lot of water before they get on a plane, to keep their blood thinned out?
Yes.
Okay, very good. I thought it was, okay, I'll tell you what I thought later.
Okay.
Okay, Catherine typed in, I am in heart failure. Can Remag improve the ejection fraction? I think we talked about that earlier, but go ahead, Sharon.
Absolutely. Yeah, I mean, yes. I don't know if we've listed them, but we had so many people who will tell us their ejection fraction was in the teens, and, now it's up to where it should be in the 60s. But we can't tell you that. We just know what has been reported to us. We don't know if it's going to, you can't hold us to it, I guess. We're not giving you a medical recommendation there.
Kathy types in, I'm currently taking all your products, and I've been for a couple of years. They're wonderful. I only mentioned the 3-in-8 because I read that it is a newer form. So just to let me say, Kathy, that the newest form of magnesium is Remag. It is the leading edge of creation form.
The newer form business is just so they could patent it, and they could charge so much for it, and now you've got Mercola pushing it and saying it's the best thing there is, and he knows better.
Right. Okay, we won't go into why he knows better, but we'll leave it at that. Okay, now, how do Remag's bioavailability absorption rate compare to magnesium oil? Are they similarly effective?
Somehow that blurbs out.
Okay. Remag's bioavailability compared to magnesium oil, are they similarly effective?
No, I mean, it's a weird question. Remag is up to 100% absorbed at the cellular level. Magnesium oil is a whole different form of magnesium. If it was magnesium Remag lotion, it would be absorbed the same as Remag. All you have to do is test yourself with Remag lotion and magnesium oil and see if you get the same effect. And according to our customers, you don't. The Remag oil, I know when I was trying to slather myself with it before, the magnesium oil is just supersaturated magnesium chloride in distilled water. And I used a lot of it before Remag, and my skin would just get so irritated and itchy. It was very strong on my skin, and I couldn't dilute it too much because I needed a lot of magnesium. So we got beyond all that business by doing the Remag lotion.
Very good. Excellent. Excellent. Okay, let's take a few phone calls, Carolyn, as to not keep everybody holding on too long. Let's go to area code 248, the great state of Michigan. You're on the line with Dr. Dean. If you could give us your name and then state your question or comment.
Mary. And
okay, Mary.
Yes, and my question is that I had a thyroid removed, and I know that the doctor said that you must have calcium supplements for lifetime, and I know you have to wait like 4 hours between the magnesium, so I'm listening to your magnesium. Would I have to wait 4 hours? Also have AFib, wants to get off of blood thinners. I just heard you mention something about warfarin, and you would take it, and I understand that that's what they're putting me on, but I don't like it. It's not, I don't like the way the effect is, and I know that I've taken something that's natural that has really brought the INR level up higher, so I'm really wanting to do that more so than taking a chance on the blood thinners, you know. But I'm so excited. I cannot wait to start your Remag and your Remite. This is new to me. I've never, heard of this before, and then I've heard of a couple of people who have had AFib that have been very successful with your products.
Wonderful. Thank you. Okay, so what's going on here that you're talking about, Mary, is when they removed your thyroid, they probably took your parathyroids as well, correct?
I have this sounds terrible. I just know that they just removed the thyroid. That's all I know.
Right. Well, write into support@rnareset.com, and I'll send you the section on parathyroids. They're tiny little beans, like kidney beans, on the sides of the thyroid, and they often are taken away when they do a thyroidectomy. And then the parathyroids, they keep your calcium in balance. They help your calcium metabolism. So that's why they say to you have to take calcium. And when they say that and they leave out the magnesium part, it's very difficult for people because then they get calcified and they don't have enough magnesium. And so what you're going to do is just slowly build up your Remag and help your symptoms. And as your symptoms improve, you'll know you're getting enough magnesium, and then you're going to be taking your ionized calcium blood test. I don't know if they're saying every 3 to 4 months, but you're going to watch that like a hawk to make sure that you're not getting too much calcium.
Okay.
And what you can do as well, it's going to be part of the experiment, that the calcium they give you, it's only going to be absorbed like a little bit, 4 to 10%. The rest of it can go and create the calcification that I talk about. So you'll be in touch with customer service. They'll put your questions over to me, because what would be awesome is if you could use our Recalcia at much lower doses, at a better absorption, take care of your calcium in that way, and then balance things out. I think that would be incredible.
Well, that's fine with me. It's just, and I guess my major thing is just really getting rid of this AFib. I can, deal with all of the other stuff, but the shortness of breath is just, it's like the life is gone. I just want to get rid of that. They put you on beta blockers, and see, originally I wasn't doing the blood thinners because I refused, and so they had me on the aspirins. But then he said, if you want to do a cardio conversion, then you have to be on the blood thinners. So that's when I switched over to the blood thinners.
Right, I understand. Yeah, and as I've said many times during every show, don't get off your meds. They're there for a reason, and as you improve, then a common sense doctor will help wean you off them. But and in the beginning, Mary, just do what they say, even with the calcium, and start with our products, and then we'll think about switching to Recalcia instead of their calcium. But you got to get stabilized on all their stuff first. You see what I'm saying?
Right. Do I have to wait 4 hours with your magnesium?
No.
They say,
no. I mean, I don't know. That to me, that's crazy talk. It doesn't compute.
Oh, because that's what they, if you're looking at on the medicine, it says if you're taking any magnesium or calcium or something like that, you have to wait 4 hours.
No, that 4 hours before what? Before you take a medication?
4 hours
or what?
after 4 hours after the medication.
Right. Not with the magnesium. I don't know what kind of calcium they're giving, but see, think of it this way. Magnesium is like food. You have magnesium in food, and you're just taking food. So when you take it, don't let that little niggle of worry come into your brain, okay?
Okay, so that's what I guess that's the problem, because, all the things, and this is my last thing and I'm finished, all the things that they're telling you to do that's going to improve your AFib is eating a lot of green leafy vegetables and a lot of magnesium and potassium, but they all interfere with the warfarin, and that's what the whole problem is. It's kind of like an oxymoron in a sense.
Right. Gotcha. Yeah, that's why you really need the Remag. And I don't know if you've gotten a hold of my AFib book, Atrial Fibrillation, Remineralize Your Heart. That's a free download at drcarolyndeanlive.com. That'll give you a lot of answers.
Oh, okay. I don't know that. Okay, so I will do that.
Perfect. So what's the snow like there, Mary?
Well, we haven't really gotten it bad yet, but they said it should be coming Saturday.
Oh, dear.
But thank God we haven't seen all of that mess yet.
Okay, good. Okay, well, hunker down and stay inside and listen to the archives of my radio show, okay?
Okay, thank you very much.
You're welcome. Okay, thanks for your call. Bye, Mary.
Bye-bye.
Excellent. Okay, let's go to area code 847 in great state of Illinois. You're on the line with Dr. Dean. If you could give us your name and then state your question or comment.
My name is Karen. I'm hoping you can hear me.
Yes,
hey, Karen.
Okay, great. My sister had double heart valve surgery about 4 years ago, and she's currently right now in the hospital. She was admitted with major fluid retention in her feet and AFib, difficulty breathing, enlarged heart, all things she's been dealing with for a number of years, along with obesity, which has just gotten worse. But they've taken her off the 500 milligrams of magnesium twice a day that she takes at home. She also has taken Remag. When she can afford to buy it, she takes it. But otherwise, I think it's magnesium from the Vitamin Shop or some such place. But they've taken her off her magnesium completely. I believe they're just going to make matters worse, and they may have to cardiovert her, as has happened on 2 other occasions when they couldn't get her AFib under control. And I'm wondering, what can a patient in the hospital with this situation do when they won't listen, but you have major breathing, lung, and heart issues, so you can't just, I guess you can't just go home and see what happens.
No, that's really, this is so unfortunate with all the information we have. Okay, so you're going to print up that subclinical magnesium deficiency. Did you hear me talking about that at the beginning of the show, Karen?
Not at the very beginning. I missed it.
Oh, okay. So there's an article out November 2017 now. Subclinical magnesium deficiency, a principal driver of cardiovascular disease and a public health crisis. And I don't know. I'm looking through it and see if he talks about atrial fibrillation. That might be something, there's AFib is talked about. It might be something that would influence her doctors that for you to say, look, she's been on 1,000 milligrams of magnesium at home. You've taken her off it. This is going to be a problem. She's going to have withdrawal effects from lack of magnesium. And these papers show it's got like 230 references. All these studies show that how important it is. And there's that to do, and then there's also to get the Remag lotion, put it in a body lotion bottle, and get her to apply it to every exposed surface.
Okay, I just got the magnesium lotion for the first time myself this past week, and I don't know for sure, but I think it is helping my my nerves, my anxiety. It's too soon to tell, but I'm sensing that maybe it's doing something for me.
Good. Yeah, and this is very stressful for you, what's happening right now, and it's very frustrating. So, you keep taking your Remag and give her some of the lotion as well, and get that paper to them.
Okay,
maybe
great.
someone there has a hint of decency and common sense and wisdom that they would recognize what they're doing.
We've actually done this before when she had her surgeries, and I was able to get some papers to one of her doctors, and it made them, after they did everything else, all their protocol, including cardioverting her twice, or was it 3 times, they gave up and said, okay, we'll do the magnesium after reading the papers, and they were able to get her AFib under control. It was awesome, but no one will do that now.
Oh, dear.
So I'm afraid for her now.
Yeah, I hear you. Yeah.
But thank you. I will look up that information and get it to her, and hopefully she can get it to her doctors.
Okay, Karen. Thank you, and good luck.
Thank you. Bye-bye.
Bye-bye.
Okay, wonderful. Live with Dr. Carolyn Dean here on achieveradio.com. Again, the number 602-666-6027. And if you're on the phone and you want to talk to Dr. Dean, you have to hit *5 on your keypad to raise your hand in the studio and let me know that you've got a question or comment. Otherwise, you'll be on hold forever. Because I won't know that you want to talk to Dr. Dean. Right now, I don't have any hands to speak with Dr. Dean, so we're going to go back to our chat line. And, Carolyn, let me read you a couple of these. Anita types in, my vitamin D level was 104 in May 2018 from taking high doses of vitamin D. Since that could have increased my calcium, should I get less than 600 milligrams of calcium in my diet? How do I know if I have too much calcium on my body? My regular calcium test was 9.9 with a range of 8.7 to 10.2. Is that test accurate? I take Remag, Remite, Realign, and Pico Silver.
Wow. Well, I should say wow, Anita, because if you have my Magnesium Miracle book, I'm just looking it up right now. It's the section on parathyroids that we're going to send out, and it's I have something very specific that the Norman Parathyroid Center in Florida says about calcium, and I'm just looking for it in that section. They say that anyone with a certain level of calcium in the blood should look at their parathyroids. And I'm just trying not to miss it here. I really should mark this section because I use it a lot. Okay. According to the Norman Parathyroid Center, adults over age 35 should not have calcium levels higher than 9.9, where the average range is 8.8 to 10.7 milligrams per deciliter. And that's because at that level, the parathyroids are allowing too much calcium in the blood, and then that leads to magnesium deficiency symptoms and calcification. So you're rated 9.9, so I'd really be watching that. Now let me go back to, you're saying, okay, so it could have been the vitamin D, of course, could have increased it, because vitamin D, it's a hormone. It shouldn't be bumped up with high doses, and high doses are usually synthetic. It's just another medical iatrogenic situation that's been caused. So personally, if I realized I had inadvertently increased my calcium, it was testing high, I wouldn't be, I would cut back on everything. When I was treating my heart palpitations in the beginning, I had no dairy, no calcium supplements for years, and I never noticed any problems. I never noticed that knee aching that I distinguish as my calcium deficiency. So personally, yeah, I would be avoiding calcium-rich foods. Back to you, Ginny.
Excellent. Very good. Very good. Excellent. Can you talk more about how Remite can help with serious burning neuropathy?
Well, talk more about it. I'll just say it can help. The diabetic neuropathies that people get, magnesium deficiency is one of the signs of diabetes. Magnesium is very important for all the nerves and muscles. Any nerve or muscle problem in the body, I would treat with magnesium first and foremost before going to the neurontins and the addictive chemicals that they do give. Personally, I'd be saturating with 3-4 milligrams of magnesium liquid and slathering Remag lotion on the burning neuropathy site.
Very good. Jen typed in, 5 years ago I took statin and muscle weakness appeared in all my extremities. Perhaps the chronic fatigue existed for years. I started to take Remag, but probably not enough. I think because my blood pressure is high, my blood pressure was acidic, getting gout occasionally. My diet is mostly vegan, so no animal products, lots of raw fruit and veggies. Weight does not come off no matter what I do, just increasing the mag to 4 teaspoons and Remite. Is that the solution?
No, there's a lot going on here, Jen. And it may be at the vegan level, lots of fruits and vegetables. Well, fruits, that's very high carb. Starchy vegetables, high carb. You can't lose weight. You can't go into fat burning unless you reduce the carbs. That's what I found out from my fruit weight gain over here in Maui. I can't eat that much fruit anymore. It stops my fat burning. And the high blood pressure, if the statins gave you weak muscles, that implies 5 years ago you were magnesium deficient. Blood pressure is related to magnesium deficiency because the smooth muscles of the blood vessels go into spasm and tighten up the blood vessels and create high blood pressure. Personally, if you can possibly switch your diet and eat some animal protein and get the weight gain under control. I mean, it's your life. I don't know what your veganism is. You can go to Shakaya's radio show guest spot that she did with us. Do you remember when that was, Ginny? Was that the October show? I got it here. October 1st, 2018. Go to that radio show archive. October 1, 2018. And this is a 25-year vegan vegetarian who found that her 25 years of insomnia were due to her diet, and she switched off. So you've got a lot going on that could indicate nutrient deficiencies. People who are vegans and vegetarians think that because they eat lots of fruits and veggies and they're covered, but when you hear me talk about 100 years ago, we could get 500 milligrams of magnesium in the diet, and now we're lucky to get 200. You know why you're causing all these magnesium deficiency symptoms.
Very good. Excellent. Excellent. Okay, next question. Linda says, no liver flush, and earlier you had said you wouldn't do a liver flush too, in response to a specific person's health condition. And it says, now I'm confused. Dr. Andrea Moritz would disagree. Find confused.
That's fine. I don't care if anyone disagrees. I just know when I was in practice and people would come to me with their liver flushes and feeling worse, it seemed to be the reactivation of viruses that the liver was trying to protect them from. So I don't quote, believe in liver flushes. I just believe in gently giving the body the building blocks so it can do its own detoxification as it deems necessary. The body works in priorities. The priority in our mind that, my liver's toxic, I need to detoxify my liver. Well, what if the liver is protecting you, et cetera, et cetera? There's so much fatty liver now. There's so many problems, and then we just blast away with our chelation and our bowel flushes and our liver flushes. To me, it just never made any sense. And then when I saw clinically how it affected people, then I just can't advise it. And, yeah, maybe out of 100 people, maybe 80, it's fine. And then 20, it's not so fine. And a few, it's very bad. I will not engage in something that can be very bad for anybody when I know I don't have to. There are a lot of heroics in medicine now, and I just don't engage in it. But I mean, you can do what you want to do. It's like, I think part of that also was that what was it? Oil and lemon juice. What oil was that? Shoot, the gallbladder flush. Isn't that funny? Okay, gallbladder flush that people were doing, and what would happen is they would take this oil and lemon juice and push out stones and get them stuck in the common bile duct, and then have to have surgery. And
goodness gracious.
Yeah, so it's lemon juice and olive oil, of course, olive oil.
Ugh.
And of course I did it. I mean, I try all these things, and it was just so yucky. I couldn't stand the taste of olive oil for years after. But I would never tell anyone to do a gallbladder flush. People will do it. They'll do it on their own, and that's fine. But I'm not going to be the instigator of something that could harm a person when there are safer methods to gently support the body.
Right. Excellent. Excellent. Very good. Let's take a couple phone calls. We'll go to area code 307. Oh, Wyoming. Oh, gosh, we love Wyoming. Hello, hello. You're on the line with Dr. Dean. If you could give us your name and then state your question or comment.
Can you ladies hear me first?
Yes.
Yes.
Yes, yes,
Hi,
yes.
my name is Ralphine, and I'm from Wyoming. How are you guys doing?
Okay.
Hey, my question is in regards to the bladder. Myself and my granddaughter were both born with an overactive bladder. through the years, I've learned to put up with and deal with mine. However, I was just curious as to whether you have any suggestions that might lessen the frequent trips to the bathroom. And if you had this disorder, Dr. Dean, what types of things would you do to help it?
Right. So have you found certain foods or drinks trigger it?
Well, you know, growing up, here I am 54, I've been dealing with this my entire life, and yes, sodium, not sea salt, but sodium can aggravate. So can too much caffeine. But with the granddaughter, she's not like that. She doesn't eat a lot of salt. She eats no dairy. She doesn't, drink a lot of things that I do. And so, yeah, there's a few triggers, but I don't know that they're that big of a deal. And I don't know how much of it's in your head. You know what I mean? And not from a physical condition. So I'm not certain about that.
Right. Yeah, I remember a young girl I worked with who had an overactive bladder, and what was happening with her is she would try to suppress her urination, and then the bladder got stretched, and then she had some incontinence. I don't know if that has happened, but you know what it makes me think of? I jumped to total biology. Have you heard us talk about total biology, Ralphine?
I have heard you discuss it, yes. I would have no idea how to look into that, though.
Right. Well, total biology of the bladder, the overactive bladder, is they kind of equate it with what a dog would do in marking his or her territory.
Okay.
It's like I need my urine to be precisely, immediately available for me to mark my territory. So in the total biology sense, that's someone who kind of has to fight for their territory. And, I don't know how it relates to your granddaughter or you, but that's sort of where I would say to someone who's dealt with this all their life, and, you've obviously tried all kinds of different things, I would look at, well, why does the body think that it's required to have this activity level of the bladder? What is it trying to help the body with? What's it trying to prove? And the way we work with people about the total biology aspect, the conflict basis of their condition, is we'll send you out some books about it, some videos you can look at, just to get a sense of what the possibility. And also there's a referral to a medical doctor who does telephone consultations to help a person figure out, well, what is going on. And in total biology, what's interesting about having your granddaughter also affected is it implies that there's some sort of genealogy, ancestral involvement, where did other people have this? Was this sort of passed down as a conflict, not as a disease or anything, but as a conflict with the overactive bladder as the solution to the conflict? Do any of those words make sense?
They do.
You don't have to share, but if they make sense enough for me to send you the information, then I'd be happy to do that.
Yeah, and I've purchased items from you guys, so my email is in there. You guys can send whatever information that you have. What about if somebody has, like, urinary tract infections, too, and on occasion those are, and it might not always be an infection, but it could be an irritation also that doesn't always last long. But what could you do in an instance like that? What would you suggest?
What you do there is go to drcarolyndean.com. I've made my 600-page Future Health Now encyclopedia available for free so people can access information. And I have a section on it's either bladder infection or cystitis, cystitis, and it discusses the various aspects. It could be bladder irritation, urethral irritation after intercourse and what to do for that, or just short-term bladder infections where you can use something called D-mannose, M-A-N-N-O-S-E, for that.
I was going to ask you about that also. I do use it. In your opinion, do you think that stuff is effective or even works? What's your opinion on it?
Well, I've fortunately never had to use it, but according to the studies, it seems to be as effective as an antibiotic, so it certainly would be on top of my list.
Would you guys email me that section in that book? I do have all your Future Health Now books. I just don't know which one it's in or what area. If Ginny would send that section to me so that I can find it easily.
Okay. Type into the chat or yes, email support@rnareset.com, and one of our wonderful customer service people will send you the information. Ask for the Total Biology FAQ and the Future Health Now encyclopedia.
Okay. I will do so.
Okay, doke.
That was my question. Thank you very much. I appreciate you guys very much.
Oh, we appreciate you, too. Thank you for calling in.
You're welcome. Have a good evening.
Thanks.
Bye.
Bye-bye.
Okay, excellent. And off to the great state of New York, area code 518. You're on the line with Dr. Carolyn Dean. If you could give us your name and then state your question or comment.
Yes, my name is Laura. Thank you very much. I actually had emailed my question in, and I missed the beginning of the show, so if you did answer it, I have a different question to ask. The question I had emailed in was about I was born with a bicuspid aortic valve. So do you know if you already answered that at the beginning of the show?
I did not. I don't remember that. Yeah, go ahead, okay. Laura.
All right. Sure. I'm a 63-year-old woman. I was born with a bicuspid aortic valve. My latest cardiology exam showed mild stenosis of the valve, and I don't have any symptoms. So, there's nothing the doctor's concerned about. He said that it's consistent with my age and this disease process. The doctor made no mention of magnesium or vitamins D, K2, MK4, MK7, for keeping arteries and valves clear of calcium and deposits. And I wanted to know what you would recommend for someone with a bicuspid aortic valve who's beginning to have, what he called stenosis.
Well, was it a calcification, Laura?
I don't know the answer to that. He simply said that it's mildly, it was stenotic or stenosis.
Right. Well, just ask the question, through the office, how much calcium buildup was there on the valve? Just say it like that. Just imply there's calcium and how much was there, because that's usually what the situation is. They never talk about calcium until they designed this coronary artery calcium scan. Now, calcium is a big hoo-ha. But if they can say how much calcium there is, then with the REMAG, there's the big chance of the magnesium dissolving the calcium in soft tissue areas where it's not supposed to be. And what we do for the K2 is in our store we don't make the product, but we really like the Blue Ice Royal, which has vitamin A, D3, and K2 in. It's a food-based supplement, so it's not synthetic, and that's what we use there. So it's. And did you say they make no mention of calcium as well? Why did you mention calcium?
No. The calcium was never brought up. The only word that was brought up was stenosis. and I'm new to understanding that, in fact, stenosis means calcification of the heart valve.
Yeah. Okay. Okay. Good. Yeah. And it's confusing for people because we do get people say, "Well, I have stenosis," and they're made to think it's like all of a sudden the tubes in their body are smaller. And given no reason for it, but as long in your mind, if you know it's calcium and you know magnesium dissolves calcium that's in the wrong places, then that's going to be very helpful.
Right. If I could ask one more question,
Sure.
I recently suffered a concussion. I was struck in the head by a ball, and I would love it if you would talk about magnesium and healing the brain. Thank you very much.
Right. Oh my gosh. Yeah, that's terrible. Have you had headaches or any sequelae?
Yep.
Okay. So what I do is I work with arnica, the homeopathic arnica.
Okay.
And you know arnica. You're a New Yorker.
Yes, I do.
Right? And let me see, 6, 30, maybe a 30C arnica. And I would take it maybe just twice a day and see if see what that does. If you say, oh, this seems to be helping, like you can continue it, but it's possible you should see a homeopath that you might need like a 1 million dose just to knock it out. So it's almost like with what you're doing here is just deciding if the body thinks the arnica can help.
Ah. Okay,
yeah.
And then you said the 1 million dose, you'd have to go to a practitioner?
Correct.
Okay.
And, I mean, there are a lot of homeopaths in New York. I'm sorry I don't even have a list, but you can start asking around. And then the whole thing, go ahead.
No, go ahead. No, you go ahead.
In my book, Magnesium Miracle, I talk about traumatic brain injury and the extreme importance of magnesium at the time or after the fact. How long ago were you using?
It occurred back in May, and I bought your book immediately and immediately instituted magnesium because apparently after a brain injury there can be a glutamate cascade in the brain, and the magnesium stops that. And I will tell you that the magnesium really did help me a lot. So yeah.
But you're still having the headaches.
Oh yeah.
Of course. I remember one patient up in Toronto. She came to me and she had just horrible headaches, and she described them as migraines. And of course, I took the history. When did they start? And she'd been hit in the head with a baseball bat.
Yeah.
And I said, and that's where we worked with the arnica. But I said, well, did the doctors realize that's what caused them? Something like that. And she said, oh, they didn't really think anything about it. They didn't equate being hit in the head with a baseball bat with lifelong headaches. Now, that's how crazy things are. Now, are you on the Remag?
I'm poised to buy it. I immediately went out and bought magnesium malate. I had read that people with CFS and fibro, have a good reaction with magnesium malate. So I am going to go and buy, and I also got some spray magnesium locally in our co-op, but I am going to buy your magnesium product because I think it probably is the ticket.
Right. It'll be absorbed so much better at the cellular level, and when you're done with the magnesium spray, you can use the Remag lotion, just on your forehead and the temples and all that. Where was the site of the contact?
The left side of my head, ear, and neck. So it's a bad one.
Oh dear.
Yeah.
What about craniosacral therapy? Have you looked at that?
I did start doing that. It's a long story. The health system in New York State is, I think, failing. So I'm not getting PT at the moment, but I was getting really good PT. And it did include craniosacral therapy. Wow.
Yeah. But you're calling in. You're still not perfect. So the arnica, as we discussed, and lots of Remag, and listen to some of our other shows, etc., and see if adding the Remite would be helpful, because the Remite, it's got the minerals that support the thyroid. And when the thyroid is a bit sluggish, it can affect the head. I don't know. I just have a sense that might help you as well.
Well, I listened. You several callers talked about sleep problems, and since this injury, I've had major problems with sleep. So I think I'm hopeful that your magnesium will help with that.
Of course, yeah, for sure it will. And keep in touch with us, Laura. It's a little bit of a complex situation, so keep in touch with customer service so we can help fine-tune things, okay?
Yeah, and Dr. Dean, I want to thank you. Probably many of the callers feel the same thing. It's incredible what you're doing for us. We can't get this help through our physicians. So what you're doing is just wonderful for us patients. Thank you so much.
Oh, you're very welcome. Thank you. I couldn't do it without you all. I mean, I couldn't do it without you. You couldn't do it without me. So it's a mutual admiration society. That's for darn sure.
Right. Thank you so much.
Thanks. Bye-bye.
Bye-bye.
Okay, excellent. Carolyn, let's go to some rapid-fire questions from the chat line. Yep. One of them is this one from Ola. Is it safe and beneficial to take magnesium even if atrial fibrillation is low, i.e. 40s and 50s, AFib is intermittent, and when in sinus rhythm, the resting heart rate is 40s?
Yeah, that's a tough one, Ola, because, that's the heart rate when they start talking about pacemakers. And magnesium does, it relaxes the blood vessels and then that can lead to sort of a slowing of the heart rate. That's one of the things in the Magnesium Miracle 2017 book, where I talk about the 4 contraindications, and one is bradycardia, a low resting heart rate. So I think personally, if that were me, I would just maybe take a 1/4 teaspoon of Remag. Like, just take enough to see if it's going to be beneficial, because there's another aspect of magnesium deficiency that can cause the autonomic nervous system to be a little slowed down and cause a low heart rate. It's a tricky one. I'll definitely admit it, and I won't be cavalier about it to say that, go ahead and do it. I know that it can be problematic. The note I have on this underactive autonomic nervous system is it's more about low blood pressure, and it can be slow pulse. Magnesium deficiency can cause an underactive autonomic nervous system, leading to low blood pressure and poor circulatory system performance. Some people think magnesium will lower their blood pressure further, but slowly increasing magnesium will treat the problem and improve the blood pressure. And I have a sense that the heart rate would respond as well, but you may be on the edge of needing a pacemaker. So that could be very helpful for you if, and I don't know anything about your condition, obviously, but if you're having symptoms from lack of oxygen to the brain, lack of circulation from the slow pulse. That would be something to look at, getting a pacemaker.
Very good.
That was not
Karen,
short and sweet. I apologize, Ginny. Go ahead.
That's all right. That's okay. Well, it was fine. Karen, what can one do if they're on imidazole, which is a black box drug I'm taking for AFib? I spent 15 days in hospital and had more drugs than you can imagine. Doctors push this drug as a last resort. I want off it. I'm going to battle when I go into the doctor on the 21st, and I will bring your article.
Oh, good for you. Yeah, imidazole, that is an iodine drug. Oh, right. Yeah, we've had people who've gotten kind of iodine toxic with that, but if they tried all kinds and they ended up there, I guess personally I'd read and reread the AFib book and do everything that CB, one of our Carolyn B, she's one of the model patients, do everything she did to try to overcome the conditions so that you don't have to take the medication. And yes, if you can get them on board to allowing you to take magnesium, that's all you can do is try to get their blessing. But anyway, I guess you'll just have to keep us posted, Karen.
Shane types in question, hi, Dr. Dean. Your protocol has brought my blood pressure from high to perfect in 6 months. 40-year-old male. I have heard that ascorbic acid, 3 grams, and lysine soften arterial walls and heal plaque buildup. Have you heard of this? And if so, is this a short-term treatment? I currently take whole vitamin C, 400 to 800 milligrams. Just curious your thoughts.
Okay. I was riding around looking at the Motorone, and I lost my RNA radio show notes. Okay, here. I'm back in action, sort of, and I need to hear that question again.
Okay. The question is lysine and ascorbic acid, softening arterial walls and healing plaque buildup, which is ironic because they're both in restructure, right? But it says, have you heard of this? And if so, is this a short-term treatment? I currently take whole vitamin C, 400 to 800 milligrams.
Right. Now, is it ascorbic acid that he's saying?
Yeah, ascorbic acid.
Ascorbic acid. So, well, that's where what our friend, our orthomolecular friend was on with
Dr. Paul?
No.
Oh, Andrew Saul?
Andrew Saul, yeah, Andrew. High-dose ascorbic acid, yes, that's used as a chelator. Now, lysine, you really have, lysine, we do have it in the RNA drops. I don't know. I guess what we say about that is with the REMAG, we want people to focus on the REMAG and the REMITE, et cetera, and we have such good results that I'm not going to get distracted with a whole lot of other things, because when you take lysine, you throw off arginine. Lysine in high doses, we think that our extra 1,000 milligrams of lysine in the restructure is going to be working on that level. And we do want food-based vitamin C that also has the ascorbic acid, so they can work in conjunction. So, yeah, like Ginny said, we're probably doing that, but not doing it with a hammer of, several grams of ascorbic acid. So that's what I'd say.
Very good. Excellent. Okay, if you didn't get your question answered, you can always email support, SUPPORT, at rnareset.com, and we'll get it to you that way. The final question we've got this evening, with only 1 minute and 38 seconds, is what does Dr. Dean think of coffee enemas?
I love them. Sometimes I'm very addicted to them. I'm sorry, I can't help myself. Oh yeah, I definitely do a coffee enema at least once a week, and sometimes more.
Very good. Excellent.
And
yes.
actually, in our weight loss book, I think it is, or which I keep forgetting. In one of our books, either Reset Your Ideal Weight or the Align book, maybe the detox book, I have a scrupulously detailed description of coffee enemas because I love them so much. So there.
Very good. Excellent. Well, this was a marvelous show. Thank you, everybody. Great participation on the chat line. Print off those articles and take them to your doctors, take them to your family members, take them to their grandparents, take them to your across-the-street neighbor, and let people know that there is a threat, but we've got the solution, and we want people to have a healthy, wonderful 2019. And let's get rid of that nasty death rate, right, Carolyn? Goodness gracious. Everybody wants to live forever just like us, right?
Yeah. Absolutely. Thank you, Ginny. Thank you, Bob. Thank you, Bill.
Thank you, Ginny.
Thank you, everybody. Thank you, Bill. Bye, guys.
Bye-bye.
You've been listening to Live with Dr. Carolyn Dean here on AchieveRadio.com. Till next time, so long. Thanks for all the fish.
AchieveRadio.com. Psychic radio, holistic radio, spiritual radio. This is